Have you heard that you should pour oil on a tick to make it let go, or that you're supposed to twist it out on your skin? What if I told you both of those are wrong and can actually increase your risk of infection? I recently delivered a company-wide training on tick safety during their health week, and I realized how many people still have misconceptions about this topic. So in this video, I'll walk you through how to prevent tick bites, what to do if one bites you, and when it's time to see a doctor. Let's dive in. Ticks might look small and harmless, but they can carry some serious infections. Lyme disease is the most well-known, but depending on where you live, ticks can also spread tick-borne encephalitis, anaplasmosis, or even babesiosis. Not every tick is dangerous, but if it stays attached too long, the risk of infection increases significantly. That's why knowing how to protect yourself and act quickly makes a real difference. If you are going into nature, whether it's hiking, gardening, or just walking the dog, tick prevention starts with your clothing. Wearing long pants and long sleeves helps, and tucking your pants into your socks may not be fashionable, but it absolutely works. Stick to marked trails and avoid tall grass or dense brush. And when you come home, do a full body tick check. Look behind the knees, around the waist, under the arms, behind the ears, and through the scalp. A tick check only takes a few minutes, and it can save a week's or even month of health issues. Let's talk about repellents, because they really do work when used properly. The most effective repellents contain either DEET or picaridin. Aim for at least 20 to 30% concentration. And please note that picaridin is often better tolerated if you have sensitive skin. But if you are looking for natural options, lemon eucalyptus oil is the plant-based repellent that's been shown to offer protection. And I actually bought one based on this oil from some Polish brands. Others like lavender or citronella oil might help a little, but they don't last very long and they are not reliable in high-risky areas. So if you are heading into the woods or camping, use something proven. You can even layer synthetic and natural products if you prefer a balanced approach. So what if you find a tick already attached? First of all, stay calm. Don't pour oil on it, don't burn it, don't try to smother it with anything. Instead, grab a pair of fine type tweezers or a proper tick removal tool. Get as close to the skin as possible and pull upward in one steady slow motion. No twisting, no squeezing. Once it's out, clean the area with soap and water or alcohol. Here is really nice video that shows how to remove tick properly from your skin, and as you can see, no twisting, no squeezing, just getting it as close to the skin as possible and just pull upward in slow motion. Now, after a tick bite, you need to watch your body for the next few days or even weeks. If you start to feel unusually tired, develop flu-like symptoms, or notice a red rash that spreads outward like a bull's eye, it's time to get checked. That kind of rash is the classic sign of early Lyme disease. Doctors often won't even wait for blood test results. They will start treatment right away based on the symptoms. If needed, they may order a test like ELISA. It's a blood test used to detect specific antibodies in your body. In this case, antibodies that are produced in response to an infection like Lyme disease. If positive, they may confirm it with the test Western blot. Early treatment is the best way to prevent complications. On the tick safety training, one lady asked me if there is a vaccine for Lyme disease. Right now, there isn't one available to the public, but there is good news. A vaccine called VLA15 is in the final stages of clinical trials. If approved, it could be available in the next couple of years. But here's something you might not know. There is already a vaccine for tick-borne encephalitis, or TB. It's available in many countries, and it's especially useful if you live or travel in high-risk forested areas. If you spend a lot of time in nature, it's course, talking to your doctor about whether you're a candidate for that vaccine. Ticks are part of nature, but they don't have to control your time outdoors. The key is to act early, use proven protection, and know the symptoms to watch for. Check your skin, use the right repellent, and if anything falls off after a bite, don't wait. Just consult with your doctor or get checked. If this helped you feel more prepared for tick season, hit the like button and subscribe. I share practical health advice like this every week. And I'd love to hear from you. Have you ever found a tick on yourself, or do you have a favorite repellent or prevention tip that works for you? Drop it in the comments. I read everyone.